And this is definitely a celebration for Isabel's house, which is near and dear to all of our hearts in the office. But it's also a celebration of all of you. A number of you have been in the office already, and these discounts are our way of saying thanks for coming in and being tortured. So, understanding how the face ages, there's a reason we have the mother-daughter pictures up there. One of them is that genetics is the number one thing that influences how you age. The second is, if I hear it once a day, I hear it 300 times, I'm starting to look like my mother, which apparently, as much as everybody loves their mothers, is not so good in the overall scheme of things. So what happens as we age? There's really three different things. Your skin goes bad, things sag, but also you lose volume to your face. And that's something that's been recognized more over the last decade. Everybody has probably heard a little bit about fillers and things along those lines. The reason for that is you lose volume in your face as well. In youth, we talk about your appearance being the triangle of youth, where you have relatively high appearing cheekbones, you have volume in your cheek, and you have a straight or narrower jawline. And it reverses as you age. You lose volume in your cheeks, things droop. Essentially everything goes downhill, basically. Which is good for me because I love my job, but not so good for everybody else. So what are the features of an aging face, looking a little bit more specifically? The biggest thing is, as you age, your skin goes. Some of that is due to sun damage, which is the number one factor, but also just aging in general causes your skin to lose elasticity. You develop brown or so-called age spots. You develop broken capillaries or blood vessels. You also run into trouble with basically your skin sagging and wrinkles developing. But also you lose fat in your face. Most people think losing fat is a good thing, and it is for the rest of your body, but it's not so good for your face. There are a number of fat pads in your face that give the curves that you want to have in your face, or that result in the more youthful appearance. And those fat pads not only lose volume, but they also sag, which shows up more as you age. Again, loss of muscle movements in your face. Muscle movements are really a double-edged sword. You lose muscle volume as you age, but you also, because of the long-term effects of muscles on your face, form lines in your face in spots where those muscles influence the skin. And so the skin, not only by losing some of its elasticity and aging and losing some of its function, also shows more of the lines where muscle movements occur. And so that's where agents that basically paralyze the muscles help. Botox, Dysport, Xeomin. Different companies make different aspects of this. And then the other thing that a lot of people don't realize is that your bones also atrophy or waste away a little bit. And that is especially true in women who have a problem with osteoporosis anyway, becomes more of a problem as time goes on. And that affects the shape of your face as well. Again, no real shocker. As you go through every decade, something new comes up. Some people say that's exciting. Most of us would argue we don't really love that aspect of things. But whoever called the older years the golden age obviously never made it to it. It's okay to age and become more wise. You just don't really want to look like you've aged. So, what do we do then, basically? Well, there's three aspects to treatment. One is maintaining your skin and then doing things to improve any of the aging effects on it. The second is adding volume to your face where you need it. A lot of people get scared about that. They don't want any more volume on their body, but really what you're looking at is replacing the things that you've lost, adding curves back where you want them. It's not so much that the curves are bad, it's their positioning. That's true over your whole body, but your face as well. And then correcting sagging. Most people really don't want to see me because I cut people for a living. I understand that, but there's no way of fixing some of the sag, especially jawline or really heavier necks. Surgery's the only way to go for that. Doesn't mean you do it, but you also don't want to do something that's not really going to get you what you want. So here's some examples of some various aging effects on people and things that we've done to improve those. In this case, now she's had a few things done, as I'll show later, but especially the skin. There are a number of treatments out there, whether lasers or light-based treatments or needles. All of them do something. It's just kind of a matter of what your problem is and what your concern is that helps us decide where we're going to go with it. Again, for simpler things, the broadband light, which is a light treatment also called intense pulse light, depending on, again, which company made your machine, will take away browns and reds. Those can be things that you're born with a predisposition towards. You can also develop them from excess sun exposure, genetics, what have you. But that is something that's non-invasive, meaning it doesn't break the skin, so there's no downtime with it, that can really give you a pretty good result, as shown here. When you look at more of the fine lines and wrinkles, whether early or late, there are treatments with lasers for those. Now you're talking a little bit deeper lasers where you're going to have some downtime, whether it's a micro laser peel, profractional, or a regular laser like we do in the operating room. I don't want you to get too lost in the details. It's more our job to decide what's going to help you the most. But it depends on what you're trying to treat. Earlier things you can do a little less, and later things you've got to get a little more serious about it. Skincare is the basis for everything, basically. If you do not maintain your skin, none of the other stuff we do helps as much. And maintaining your skin is done through multiple avenues. Most people should use a cleanser every day. Some people need a moisturizer. And then using sunscreen every day, if you won't become a vampire, as I prefer, and only go out at night, really will help maintain your skin. Prolonged sun damage over time is the single worst thing for your skin. Lightera and similar brighteners to the skin help fade some of the pigment changes or browns and reds that you see. That can be an adjunct to other things such as the lasers. The other thing that I really like, and retinol is it is the best example of that, are things that are exfoliants. They take off the outer layer of your skin, clearing it of dead skin. Retinol or Retin A is the number one thing for that, but there are other things, glycolic acids, etc., that can be a little less harsh or can be useful if your problems with your skin aren't as advanced. Sunscreen, sunscreen, sunscreen. If you get nothing out of this whole endeavor today, sunscreen every day is the best thing you can do. There's a lot of myths that we have about the beneficial effects of the sun. There are none. Vitamin D is obtained in your diet way more than any amount of sun. Now, I won't say there aren't psychological benefits to the sun. Those things are real, but it doesn't help you from a skin or an overall health standpoint. Lower eyelids I wanted to show because they're a nice example of some things you can do with filler versus some things you can do with surgery, and that helps you kind of see how we think about things a little bit. So here's a patient with some early changes of loss of volume under the eyes. Skin is still good. Adding the volume back really rejuvenates her eye appearance, as opposed to this patient who has a little bit more advanced changes with more skin sagging. Doing the surgery for her makes more sense from a long-term and from a rejuvenative standpoint. Now, it doesn't mean if we recommend surgery that you do it. You can still do the filler. You just have to realize what you're going to get out of it. then. There's nothing wrong with not going to surgery. Many people, again, because I cut people for a living, which I probably need to quit saying before my bosses back there yell at me, don't want to go to surgery. That is totally acceptable to us. We get that. But surgery also is the only thing that's going to get you certain things over time. Some people like the benefits of that because it's much longer lasting. Others just have no interest in ever doing it. That's okay. Again, a little more advanced age-related changes, both upper and lower eyelids. You can't fix that with filler. Needs surgery. What you can fix with filler. Here is a lady that came to me for surgery, who happens to be a wonderful individual, by the way, who did not need surgery. She needed volume to her face. Good genetics, very thin overall, but needs more volume to her face to put the curves back to the volume that she lost. Surgery would be bad for her, and she did really well with the fillers. This is a little more advanced filler called Sculptra, which most people don't need because they're looking at isolated areas to fill in. But if you really need your whole face rejuvenated, it gives you the volume at a better cost for a longer lasting time than some of the other fillers. Again, younger patient, showing some of the lines along the folds here, and then loss of volume in her cheeks and lower eyelids. We added filler to those areas, and that gave her a good result, basically taking things back to where she was when she was younger. This is Beth with the lips. One of the things we are completely opposed to is having lips like the Beverly Hills Housewives. That is a crime. If that's what you want, that's not us. But you can have your lips done. They can look natural and good without being weird. I don't know what's happened out, well, it's California. I don't know what else to say. Some of my best friends are out there, but there's some things that serve as status symbols there that we don't have as big of an issue with in the Midwest. So I think you need to focus on what looks natural, not on necessarily looking different. You're supposed to look better after you see us, not weird or different. That's not what we're supposed to be after. Again, some things you can't treat except with surgery. There's no way I can do this without surgery. When you have the double chin or the turkey gobbler neck, that type of thing, nothing will help that really significantly without surgery. And then it just depends on how bad you are. When you're like this, it has to be surgery, fortunately or unfortunately. She also had surgery, so this is the lady I showed you the skin with before. We also did a facelift on her, and that again is the only way that we can get the neck result to be what we want. And the jawline. One of the newest things we have, which it's really not that new, it uses radio frequency, basically heat, to change things underneath the skin. The brilliance of this company was not so much that they used the radio frequency, which was something we've had for 2 decades, common use over the last decade, but they figured out a way to measure the heat underneath the skin. One of the problems we had before is we would use this radio frequency energy, and if you used too much, it would burn people. If you used too little, it didn't do anything. So we erred on the side of not causing any complications, and it really didn't do anything. This company figured out a way to measure the heat delivered under the skin 1,000 times a second so that you can get the temperature up to what you need to cause changes without causing the complications that we would have if we tried to do it without that monitoring technique. So this is no surgery. It basically melts fat and tightens the underlying layers of the skin. This is not for everybody. It won't do more dramatic problems like I showed you with the facelift results, but it does give her a pretty good improvement at a young age, tightening things up that we couldn't have done before. So it serves between not wanting to do anything and really not having any choice but to do the facelift. And then I'll turn it over for questions.
I had noticed you were talking about the retinol.
Mm-hmm.
Why, I guess my basic understanding was vitamin C was the next for my generation.
Right.
You know, so where would the vitamin C come in?
So the question, that's a good question. So the question was why retinol is kind of one of the steps as opposed to vitamin C. So the answer is vitamin C is very good for most people. And there are a number of things like that where you're adding something back to the skin in order to improve things. All of those adjuncts are kind of tailored to the person. There are some people I wouldn't recommend retinol for. You're young, that type of thing. You don't really need it at 22, you know. But there are other people that really their skin would benefit from different things. Sometimes you need to moisturize. Sometimes your skin is too moist and you need something a little drier or less greasy. It really depends on the person. So I tried to just hit generalities without adding in more specifics. Good question. Other questions?
The little lip lines that we start getting.
The vertical ones?
Right.
Yep.
What exactly is that?
So,
Surgery or?
yeah, no, I like filler for those. And there's a couple different reasons. One, you can adjust it pretty easily. You know, you can add some in, you can see how you do, you can add a little more later. Also, usually when you see those, you've lost volume in your lips, and so a little bit of volume, a little bit of definition helps, kind of like with Beth's. And so I like that. There are not really good permanent things for those vertical lip lines because they're formed by your mouth movements, by the muscle movements. Well, with Botox, you can paralyze that, but then your mouth doesn't work right, which is really not good, obviously. And so, you know, your problem is you're not really addressing the exact cause because you can't without causing problems. So then the filler, I think, is a nice way of doing that. If you get bad enough over time, you can do things like laser treatments to reverse those lines. You can add outside materials to serve more as a base that will help those lines. And then you can also do things like a lip lift that will help those. It's just, that's a little far advanced for most people. You can get away with doing the filler. Good things are it's easy, it's in the office, you can adjust it easily. Bad thing is it wears away and you gotta get more after a year or so. So
what we did with mine is outlined them. And what would you use to outline the lips?
yeah, I mean there's a number, so if you look at fillers in general, they're all mostly based on hyaluronic acid, which is something that's in your body, and unlike blood type, it's the same in everybody. So there's no difference between any of ours in the room. There are ones that are thicker that are better for like cheeks and things like that because they hold up better and they give a little more oomph to the area. They hold their form. And then there are things that are a little more liquid, which work better in the lips, which is a highly mobile area, so they don't feel weird. And so those can be Restylane, Juvederm, Restylane Silk, Volbella. It just really depends on the company that you're going with. There are two main companies. Both of them have rewards programs. So we try and stay with one because then you get more free stuff, which is good.
Oh, me?
Oh, okay. I was calling the girl behind you, but
Okay, you go.
sorry.
Oh, I don't remember what I had done, and I should, but I don't. It's kind of embarrassing. But I had those injections under my chin.
Uh-huh.
What's that called?
Kybella.
Thank you.
Yeah.
And I liked it. It didn't do as much as I wanted it
Yeah.
to, but tell me what your thoughts are on that.
Yeah. So I like Kybella for what it is. The problem with Kybella is it dissolves fat only. It doesn't tighten up the neck skin. And so when you get beyond a certain age, or if you have too much fat there, then your skin doesn't tighten up and you trade the extra fat for the skin. The other is a lot of times I see people and they have much more skin sagging than they do fat in the area. So you do the Kybella, it doesn't get you a big bang for the buck. It's really good, you know, if you're young and you need that fat dissolved because you're just born with too much there. But it's harder without adding something else to tighten the skin up.
So would that be surgery?
Surgery or the face tight.
The face type, okay.
Yeah, because the face tight will dissolve fat, but it also tightens the skin. And so I like that combination because it's doing both things. And if you have no fat, you can do the face tighten. It'll tighten the skin and the muscle underneath. So I really like that. Now, if you're bad enough in terms of severity, basically, then yeah, you move towards surgery. But it becomes person dependent.
The slide you showed there of the woman that had that said skin tight there,
Yeah, the face tight.
then you turn around and said something like, well, she had a nose job, but had she?
No,
That was just, so she changed that much with just the skin tight?
with the face tight. Yeah.
Okay, well, what is that exactly? Is it
The face tight's the radio frequency energy I was talking about, where you measure. Essentially, it looks like a little pincers, but it doesn't pinch. You have a wand that goes under the skin and it distributes the energy, and the outside part measures the temperature. It takes about 30, 45 minutes, depending on how many areas you treat. You can do it under just local anesthesia or, a little bit of sedative or I don't care medicine, to get you through it. But most people do fine with just that, and then there's no cuts. Now you have downtime, you swell pretty good with it for a week or two. You gotta kind of lay low, but a lot of people like it because you don't have cuts and you heal pretty fast, and then the result is gradual. So right away you don't see the result, but over 3 months to 6 months you see a lot of improvement. And so a lot of people like that because it doesn't look like you had something done. It's such a gradual thing. Again, it just depends.
Do we have Penny in the room? Penny, are you here?
Yes.
So Penny, whose picture was there, so she will be here for you she'll come down afterwards, that's her picture that's up there, so she's here for you to talk to and ask questions to about that procedure. So that's kind of neat to be able to have that opportunity. Thank you, Penny.
I'm an absolute chicken.
Yeah,
I love the idea of surgery because you're asleep, you can do whatever you want to do.
yeah.
Trick is, I would like to have filler in the lip, because as the older you get, the thinner they become.
Yeah.
I understand it's extremely uncomfortable.
It can be. We do some things to minimize that. So there's two main things. One is we put numbing medicine on your lips beforehand, so that helps with the needle stick part, but it still hurts under the skin. And then the filler that we put in has numbing medicine in it. So after the first couple, it's pretty comfortable. But yeah, it's pretty uncomfortable in the beginning, but I've never had anyone, I've rarely had people say they wouldn't do it because of
The only
that.
reason why I saw someone on television,
Yeah,
and they had one half of their lip done.
yeah,
Yeah.
You gotta be committed.
yeah. Yeah, you don't really want to be your own before and after picture. So. Yeah. The filler lasts about a year. We usually underdo you to begin with and then see you back in a month, because if you add too much, that's worse than just touching things up later. And I don't know why. The first time tends to hurt more, but at a month, if you touch up, it usually doesn't hurt very much. So, but yeah, we're more afraid of brave people than we are of chickens, to tell you the truth. So, people that want pain, really, but that's not my style. So. But yeah, a lot of these things aren't fun while you do them.
I've had my share of things done, don't misunderstand.
Yeah, no.
When I'm anesthetized, I'm gun ho.
Yeah.
What type of treatments can you do for the neck?
Um,
Because the wrinkles seem to appear a lot more on our necks.
Yeah, necks and chest have been traditionally very difficult because if you use regular lasers, you scar. So now there's a couple of new lasers out that can help with that, and then it just depends. So if it's more browns, reds, earlier sun damage, then broadband light. If it's deeper sun damage where you're getting the wrinkles or the folds, then it depends on how bad it is, but profractional, there's a new thing called Fractora, which uses little tiny needles through the skin and again delivers energy through those to tighten it up. We've really been pretty pleased with that. That's pretty new. And then, some of the deeper lasers also will get it, just fractionated lasers so that you don't run the risk of the scarring, but really person dependent.
Fractora is on your price sheet. It's something that we have on special today, but I want you to know there will be some pictures I've done that too. I get to.
So have I.
I get to be the.
They make me try out some of this stuff too.
We want
So.
you to see what it feels
Yeah.
like before you recommend it. So it is something that we have things in place to make it as comfortable as possible. Chest, it's the first treatment that we've had. We all get those little lines that come this way, and they're just not pretty. And so there are some before and after pictures of mine that I had them in one treatment. It was very impressive. So just know that that's where we had profractional and different things before that didn't really work so well there. We're very excited about that. So Fractora is on your sheet, and that would be a great treatment for sun damage or aging to the chest.
Yeah, the problem is with the lasers, to turn them up to get the results, you run too high of a risk of scarring, so you kind of had to take what you could get. With the Fractora, because it works underneath the skin more, we're getting a lot better, more impressive results.
And does it help with tightening in the neck?
Yeah, tightens in the neck. So it'll tighten skin, which is the best part of the wrinkle effect, but it also rejuvenates the skin, meaning it changes the collagen and elastin back towards a more youthful pattern.
How long would that last, sir?
So it depends. 5 years is what the company quotes, but it'll probably be longer because so with the FDA, you have to spend a lot of money to get approvals for things. Once they hit 5 years, they were like, we can sell this. We don't need to do it more, but I bet you it lasts longer. We've only had it about a year less. So I don't know personally yet because it's pretty brand new. It's only been out a few years.
But it is a series of treatments.
Yeah.
I wouldn't just do one.
Yeah, usually a series, unless you're in the operating room, then you can turn it up more. But again, it's very person dependent is kind of the point on what you need. Sorry, I interrupted you.
That's okay, not a problem. What would you recommend first? The laser, like we talked about, remember, or me, and then the filler, or is it gonna matter if I get the volume first and then the laser?
I like doing one thing at a time, so if you know you're gonna do the laser, I'd do the laser first, and I'd see how good you get, because then you can hopefully use less filler, or do it a little differently then. So I like hitting something hard once if you're gonna do it, and then, looking at what you need next, depending on how happy you are with that.
Okay, gotcha. I have to change.
What's the difference?
You're allowed to do that. Some of the rest of you know, but
What's the difference between the Botox and the Dysport?
the company.
You get, it seems like you get a lot more units with Dysport.
Yeah, but it's not equivalent. So 50 units of Dysport is 20 units of Botox, or 10 units of Botox is 25 units of Dysport. So it's the same effect. That's like medicines, 100 milligrams not necessarily better than 50 for different medicines. It just takes that much to work. But I use them interchangeably. There is no question that some people have a better response to Dysport than Botox and vice versa, but not predictably. It's really the person.
And what is what is that called on here?
There's a few of them. Restylane, Silk are both good for the lips, depending on what you're going after. And then Volbella or Juvederm are both good. But we'd let you interchange those. If you get there and you bought one and we think you're better off with another, we're not going to hold you to it. We just trade it out, equal value. So it shouldn't be your job to figure out what you need. It's more to get the stuff you want, and we'll change it.
So in terms of the turn down the corners of your mouth,
Yeah.
what would you use filler for that too?
Yeah, so I use Juvederm for that, or Define, Defyne, which is the Restylane product. I use a lot of Juvederm around the mouth. It's kind of what I grew up on. I don't think it's better, but I use it because you use what you get used to, right? But the Define works well, so for some people that are using the Galderma products, like I say, because they both have rewards programs, we try and keep you on the same line, so you get extra rewards. Whereas if you switch back and forth, you just lose money.
We will have the rep from Allergan, which is the Juvederm and
Yep.
Voluma and Volbella will be here. The Galderma, we have a table out where the Galderma rep could not make it tonight, so.
They got a new rep, and so he's in training.
Would you talk and tell them about the power of BBL.
Yeah.
In each of your packets, there is a sheet that talks about broadband light or the Simply Restore treatment. So that is really a powerful treatment that everybody is a candidate for, and I wanted him to just tell you about the science of that.
Yeah, the broadband light is probably my single favorite thing since sliced bread, basically, because of some of what Beth talked about. There's no downtime, it works for everybody, it clears browns and reds, and there's a study out of Stanford that shows that it changes the DNA of your skin along a more youthful pattern, which we kind of knew, but also it repairs it. So it repairs sun damage to the DNA at a cellular level, which is really pretty cool. So the nice thing about that is it treats some things, pore size, complexion, overall skin quality, and then browns and reds. And again, there's no downtime with it. You go right back to your life right afterwards. Sometimes it turns brown spots a little darker, but that's because it breaks them up so your body reabsorbs them. And sometimes you get a little more red for a day or so afterwards, but nothing you can't hide with makeup. You're back in makeup the same day. It doesn't break the skin, so it doesn't cause breakouts or things like that. Really a pretty amazing treatment. I just wish I would have thought of it. We'll go there and then I'll get back to you.
So I see you have a treatment package is at 3. You recommend 3?
Yeah, so the way they did it so that you don't, it hurts pretty bad if you did the same power all at once. So the way they made it so you can do it in the office and tolerate it is to split it up into 3 separate treatments, about a month apart for that one. But that gets you the bang for the buck. One treatment doesn't really do it, and that's why we sell it in packages of 3 to encourage people, look, if you do 1, you may not see a whole lot. After 3, you really get the effect.
How long would that last?
3 years maybe. It depends on the person. Like if you smoke and go out in the sun all the time, you're going to run into a lot of trouble with it, basically, faster. But if you take care of your skin, you do good skin care, that kind of thing, 3 to 5 years, easy. And some of it won't come back depending on what it is. Like if you have a brown spot and it takes it out, you may be done with that. There are other brown spots that are deeper in the skin, so it fades them, but then they'll come back with sun exposure and age.
Do you notice a difference if you just have your face done and not the neck and chest? Would you recommend?
Oh yeah, with broadband light, for sure.
Okay.
Yeah. The broadband light does good, everywhere with the browns and reds, but when you really want to tighten that neck and chest skin, get rid of some of those fine lines and wrinkles and stuff that you see, that's when you got to move up to the fractora or profractional if it's mild enough.
Okay, one last question.
No
If you
problem.
have this, would you recommend Juvederm as well if you have lines on the upper lip?
Yeah.
Take care of it.
Juvederm can do both, so some of them are good just for those lines. So some people, they don't want any lip volume, they just want those vertical lines done. That's silk Balbella, basically. Some of them want more definition to their lips, like we did for Beth, where you hit those lines and you give a little more definition, and that's more Juvederm, or you can use Restylane Define there, you can use Restylane there. There's different options that I think are equally as good, depending on the person.
The Juvederm would be mainly for the neck, lip.
Lips, lower eyelids I use it for, and then I use it as kind of a catch-all, more close to the surface. So for the, for the deeper lines, I'd use something different, or for the cheek filler, I'd use, if you're in that family, I'd use Voluma, or probably Voluma, or Juvederm Plus, which is like Juvederm on steroids a little bit.
One syringe would get it then?
Depends on what you're treating. I usually say about 1 for the lips, about 1 for the lower eyelids, probably 2 easy for the cheeks, 1 to 2 depending on the person, 1 to 2 for the folds or the drool lines or the marionette lines. Just hard to say.
They laugh.
Yeah, you're okay there. Then you won't need that one. And then, did you want to ask a question here?
Me?
Nope, her.
No, I do
Fine,
too.
yeah. Oh, you do too, okay. We'll get you next.
You actually answered it. I
Oh,
was
good.
trying to decide between the Fractora and the BBL, but you answered it with the tightening issue.
Okay, go ahead.
Okay, I have the royal gorge right
Yes.
between here.
I never heard that before, I'm gonna borrow that.
Okay, you may. So what do you suggest?
Yeah, so the reason for that is this, she's talking about the folds in between your eyebrows. It's called the glabella. The cause of those is muscle problems. The muscles there do nothing except make you look older and bad and sad and whatever you want, really, and tired. I don't care. But anyway, you have to treat that with something like Botox if you're going to stop the muscle movements and then, you know, make the line fade. With relatively shallow lines, if you repeat the Botox or Dysport for a year, it'll make it fade. For the deeper lines, then you either have to add something more in there, which I'm not a huge fan of because it can look pretty lumpy, or you can go to surgery and you can either cut those muscles and remove them partly, like if you do a brow lift, or you can put something in the line itself. If you're doing a facelift, you can slip some of the stuff we'd normally remove in that area and it fills in the line. But it'll come back without doing the Botox to the area to stop the muscles from moving. And then I missed you in the back, yeah.
Me?
Yes.
The marionette lines.
Yeah.
Now, I've always thought I was doing some odd position, right? And this young lady down here told me that no, that's just aging.
Yeah.
Mine just in 2 years have gone from nothing to crazy.
Yeah. Yeah, so marionette lines are the lines like the puppet lines basically around your mouth that frame your chin. And those get deeper over time because you lose fat pads and you also have muscle movements in that area that make them stand out a little more. So that's usually filler. And again, it just depends on which company you're using. Juvederm, Define, any of those are gonna help that area. But filling those in is the best way to go. There is ways you can do that with surgery as well, but most of the time we go with filler because it's in the office, pretty easy to do. It lasts a year on average, typically. 1 syringe maybe, 1 to 2. No, I don't do a lot of surgery for that. But sometimes, like if we're doing a facelift anyway and we're stealing stuff and throwing it away, we'll slip some stuff in there if it's bad enough.
They're all going, what are you talking about?
Yeah.
Stealing stuff and throwing it away.
Yeah, that's more for me to worry about. I don't want to make this morbid here. But-
You can use the natural fat in the person's body.
Yes, you can. Yeah, fat doesn't stay well in there, so I don't use it there anymore, really. But fat can give you volume as well. Good things, you can get a lot of it because you don't need much in the face, and so it doesn't take much to help. But it serves more of a base. It doesn't fine-tune things as well as the fillers. So if you don't need a whole lot, I tend to stay with the fillers and stay in the office and not go to surgery for that. If you're doing it with other surgical procedures, then it makes more sense. If that helps.
So if you do, I've already done 3 of the broadband.
Yeah.
So do you continue with that? Do you move to something else or?
It depends on the person. So some people really like it, and so they maintain 1 to 2 a year, or some people own the machine, and their esthetician really likes beating them up, and so, oh wait, we're not supposed to be talking about meat, I forgot. But, so yeah, basically bottom line is you can maintain 1 to 2 a year, and people like it, they come in and do that, they feel good about it. I think that helps. You can also wait and 3 years later do a series of 3 again, and if you think about it, that would have been 1 a year, basically, and brighten things up again. You can maintain the results of the BBL with good skincare and, you know, lifestyle changes, not being out in the sun all the time, things along those lines. So it really depends on the person. Some people, they really like the BBL and they really get a good result doing 1 or 2 a year. Others, they're not going to see me for 3 years and they'll come back and do 3 more because they don't want to do it again.
But that's not a good starting point and then to move on to a different.
No, the BBL is a really good maintenance thing, and there's just no downside to it, so I like that better than, you know, deeper lasers necessarily, unless you're treating something. The BBL doesn't hit wrinkles as well as the deeper lasers. For that, you've got to do something more with a Fractura.
Are we supposed to figure out which one of these we want?
Yeah, no, a little of both, basically. So again, I don't want you to get too lost in all the options because that's the one nice thing about cosmetics now is there's a ton of options. So some of it really depends on you personally, and we gotta help you with that. Buying some of the stuff you think you want, we'll trade it out and we'll figure it out for you, essentially, if those are the things that make sense.
make that decision today.
Yeah, well, within the time limit allotted for the,
So you
for the
have
expo
until
pricing.
September 12th to purchase at those prices after today. So that's
Yeah.
something.
I noticed that on some of these, the package includes microdermabrasion along with BBL.
Yeah.
So what's the advantage of doing that versus just doing the BBL?
So we like the microdermabrasion to clean up or exfoliate the outside of the skin. So that takes off kind of the irregular, dried up skin layer. And then the BBL can do better work, basically. So, because it's hitting the skin directly and a little more uniformly. I don't think you have to do that. For certain people, it doesn't matter, but for most people, it just makes more
Speeds up
sense.
the process.
Yeah, we like the combination. We think we get a better result with it.
So if
That way.
in the new Renew package does not include the microdermabrasion, but it's got the profractional laser. So is that a better combination, or does it depend on the person?
Depends on the person. It's a better combination when you're trying to treat wrinkles. But if you're 25,
Right.
and you have really no wrinkles, then it's worthless, it's a waste of your time, basically. See what I mean? If you're 25 with lots of acne scarring, go back to the Renew. You see what I mean? It just depends on kind of what you're going after.
But like for me, when I have a scar, the profractional is a better.
Better. Yeah.
Talk just briefly about the difference between profractional and microlaser peel, because I
Yeah.
know a lot of people will want to get to talk to Jen, our esthetician, and those are some big things on there. The BBL is for everybody, profractional is not for everybody.
No. So the micro laser peel basically takes off the very outer layer of skin. It's a superficial treatment, but it has downtime with it. The profractional takes that up one more level where it punches little holes in the skin or in scars. And so for deeper wrinkles, that's going to do better because it's actually getting down into the deeper layers of skin. And the reason it's called profractional, it has an emphasis on the fraction, so it only hits a smaller percentage of the skin going down deeper. That way you can tolerate it in the office, and again, with a series of 3, get pretty good bang for the buck. The only thing we had like that before is the laser we did in the operating room, which is pretty hard to tolerate without drugs. Matter of fact, it's almost impossible. So the profractional, the idea is with that company, you can get the deeper laser results without having to go to the operating room and have an anesthesia.
But you will have downtime.
But you definitely have
will look
downtime.
awful
Yep.
for probably 5 to 7 days.
So when would you use FaceTime
Mhm.
versus the fracking?
Yeah. The question was, when would you use FaceTite versus some of the lasers and stuff? So FaceTite works under the skin. So it's going to give you a deeper effect. It's going to dissolve fat. It's going to tighten the same stuff we tighten in a facelift, albeit not as much, but it does.
Well, like, let's say on a 44-year-old loosey-goosey.
Yeah.
That's starting to fall. but-
FaceTite would be better, and then the Fractora or the Profractional will help more skin things. So you're talking about something that goes from the outside in. The FaceTite works inside out. So sometimes I use both. Sometimes I use one or the other, and it just depends. But for what you're talking about, 44, the FaceTite's ideal, as long as your neck's not real bad, like the lady we showed earlier.
So BBL would not be something that would necessarily help so much with that.
Different target. It's skin, but it's not going to help, the sagging there, because it doesn't tighten skin. So
what we're gonna do, I'm gonna have Penny come down. Dawn, is Dawn in here? No. So what we're getting close to the time for the doors to open, so the benefit for all you guys is you are gonna be first in. We've got Stacy up here that you can purchase raffle tickets now from her if you want to, but know that you don't have to get those before you go into the expo. You can come out on your way out and get them because the drawing's not till tomorrow. So don't feel an urgency that you want to stand in a line for 20 minutes to get, that would be silly. So we're gonna wrap up. I'm gonna have Penny come down here. I'm down here. I've had I've had numerous things, I'll just be honest.
And you look great.
Let's just kind of
She
put
looks
it
great
all
to
out
begin
there.
with, too, so.
So you will, on the Vizia, you will see my pictures, I'm just gonna tell you now, so you guys know what's up there. On the Vizia, because we have a program there that will tell you what your true skin age is. So I am 58, gonna be 59 in a month or two, and my skin age now is down to 53. So that's a very cool thing, but that's been a process of treatments with BBL, and Jen will do those treatments, and then we can watch. I've had 3 fracturas. I've had a brow lift, I've had my upper eyelids done, so it's maintenance, it's a lot of work. But that being said, it just, that Vizia picture will be up there to show you that you can come in and have a skin analysis, no cost to you. We've got cards that we'll give you out. Ask Jen for that, or anybody in the expo hall, that you come in and have a Vizia, and she'll show you what's going on under your skin, what sun damage you've got, browns, reds, pore size. That's how they determine what your skin age is. So that's kind of a neat thing to see. And then that helps you decide, what do I want to improve my skin? Then even if we've got sagging skin, it looks better if it's in better condition. So that's one thing to talk about. So then once you guys are ready, we will walk, I will take you through this door, and we'll go up to the expo in through the door before anybody, back door before anybody else goes in. Dr. Kienstra's here to talk to. I'm here to talk to. Penny's here to talk to. We've got, oh, there's Dawn. So Dawn's picture was up. She's had a lot, come on down, Dawn. Dawn's had a lot of the, she's had the BBL, she's had, tell us, what have you had she's had filler, she's had profractional, she's had several different treatments. So she can kind of tell you what that feels like, what the healing is like. So use those resources, grab him, talk, but he is going to have to be up there at 3 o'clock. So I don't even know what time it is. What time is it? 2:50, so we got 10 minutes, and Danielle will pull you, but you guys can stay here. So feel free to go up and get, but no, we're going to go out to the expo hall through here, but if you want to get your raffle tickets now, Stacy's up there. You don't have to go through the line out front, okay?